So you're wondering if there are any exercises that can help improve your eyesight. In this video, I'll share 5 proven exercises that can help you start seeing better coming up. Hey everyone, I'm Dr. Aaron Smith, and in this channel I take my experience from performing over 27,000 eye exams and go over the best tips and products to help you have great eye health and eye performance. So if you like what you see in this video and you kind of like this sort of topic, consider subscribing. So let's get right into my 5 proven eye exercises that will help you start seeing better. But before I get into the meat of the video, I want to take a second and talk about some of the main things that can actually cause the vision to be blurry so you have a better understanding as to why these exercises I'm about to show you actually work. So the eyes contain a complex optical system that takes light and kind of bends it and converges it through different parts of the eye, and the hope is that all that light converges to one single point on the inside back wall of the eye called the retina. The retina is basically neural tissue that collects a stimulus, light in this case, and then sends a signal through the brain where it ends up in the back of the brain called the occipital lobe where it can be processed. So we have that stimulus, light, that travels through different parts of the eye like the tear layer, the cornea, the pupil, then the crystalline lens that sits in the center of the eye, eventually converges through the gel of the eye called the vitreous humor, and then finally lands on the retina, which is basically that sheet of nervous tissue on the inside back wall of the eye. But then from the retina, the nerve then takes that signal through something in the brain called the chiasm back here, where some of those nerves split up, and then they go through all the different lobes that finally make it to the visual processing center in the occipital lobe of the brain. So if either the light or the nerve signal that light influence gets disrupted or blocked, then our overall eyesight or vision is distorted and sometimes blurry. So in my years of practice, the most common causes of blurry vision and poor eyesight really have been because of either the light not focusing at one point of light on the retina or because of ocular disease. So the first exercise I want to talk about is blinking exercises. The reason blinking exercises help is because of how effective it can be against dry eyes. It's estimated that as humans we have about 5-fold decrease in normal blink rate when using digital devices like computers. So it's not a surprise that a lot of people have dry eye problems with increased screen time. Usually when the eyes are dry or people have dry eye disease, there's usually a problem with the quality of the tear layer. When light hits the surface of the eye, it hits the tear layer first. And if that thin layer of tear has evaporated or has debris in it, then that light is not converging properly through the eye, and we get blurry or cloudy vision as a result. So that tear layer that surfaces over the eye when we blink is the first thing in the optical pathway that starts focusing the light through the eyes. Now, certain things can cause the tears to evaporate too fast off the surface of the eye. And this could be things like circulating air from a ceiling fan or a box fan or even a heater or AC in the car or other things. But our bodies are ready for these things that cause the tears to evaporate fast. In fact, our tears are made up of 3 layers. From bottom to top we have a mucus layer, then a water layer, then an oil layer on top. So the oil layer at the top of the tear works as a shield for that water layer against the atmosphere and against normal evaporation. So if that oil layer is disrupted or we don't have enough oil to coat the top of the tear, then our tears evaporate way too fast and then our eyes have to blink more often to compensate for it until finally our eyes get so dry that not only is our vision affected, but the surface of the eye is left at risk for not only dryness but inflammation of the cornea that leads to even more cloudy vision. In other videos I've gone over how our eyelids have oil glands in them called meibomian glands that secrete oil when we blink. If we don't blink often enough, then we get less oil coming out of these glands to shield the water part of the tear layer from the atmosphere. And our risk of blurry vision from evaporative dry eye increases. So here's an example of how to do blinking exercises. Close your eyes, count to 3 seconds, then open your eyes, close your eyes again, count to 3 seconds, squeeze for 3 seconds, open your eyes, and relax. Practice doing this every 30 minutes throughout the day for 1 full week in order to force oil, or meibum, from the meibomian glands in the eyelids and onto the tear to create an environment where the tear doesn't instantly evaporate off the surface of the eye. And I can't emphasize enough to focus on complete blinks during this exercise to fully involve all the muscles responsible for complete eye closure during the exercise. The next exercise is eyelid massages. Many times this is done after a warm compress over the eyelids. People do warm compresses with a special heat mask in order to treat dry eyes. So remember, dry eyes can cause blurry vision because the tear layer is the first lens that focuses light through the eyes. Now, many times the oil in the meibomian glands in the eyelids can become hardened and become the consistency of something similar to toothpaste. So obviously that oil would have a harder time secreting during a blink and properly coating the surface of the tear and preventing evaporation if it were a consistency of toothpaste. So warming up the eyelids may help soften the hardened oil and allow it to express better when we blink. Bad things happen when that oil begins to harden in the glands. When that oil thickens or hardens, it can even become rancid and cause conditions like blepharitis and chronic styes, which are basically bacterial infections in these oil glands. I'll leave a link in the description below for any products I discuss in the video, and check out my video all about how to properly do a warm compress on your eyelids if you think you might benefit from those. Here's how to properly do an eyelid massage. First, wash your hands and then start by using a hypochlorous acid spray to moisten the tip of a medical grade cotton tip applicator. And again, I'll have links to all the products that I discuss in the description below. So give it a spray. So I'm going to look downward and I'm going to place the tip of the cotton tip applicator at the top of my upper eyelid because I'm doing the upper eyelid here. And then I'm going to gently roll the cotton tip applicator downward, and I'm going to slowly work my way down and pause right when I get to the eyelash area. Make sure that oil comes out. And I'll work inward to outward. So I'm going to then go to the middle of the eyelid and gently, carefully roll it down. Just pause right before I get to the lash. And then I'll move out a little bit further. Gently roll it down, working that oil out after that warm compress. And then to do the lower lid, look up, close your eyes, and place the cotton tip applicator on the lower part of the inside corner of the lower eyelid and roll upward slowly and pause when you get to the margin, and then just work inside to out. And that's how you do a lid massage. Now, sometimes the oil in the glands is hardened to the point to where you'll need to see your optometrist to have thermal expression of the meibomian glands done in office, especially in cases of severe dry eyes or if the doctor notices that the oil glands are starting to drop out or go away permanently. The next exercise that can help your eyes perform better is an exercise called pencil push-ups. This exercise is especially useful if you've ever experienced double vision throughout the day or double vision when the eyes are tired. We have double vision when both of the eyes have a hard time pointing at the same object. The idea here is that if you strengthen the muscles that turn the eyes inward, the medial rectus muscles, then you'll have more stamina to converge the eyes for longer periods of time when doing near tasks like reading or spending extended time in front of digital devices. And you'll have a greater chance of not having double vision when your eyes are tired. So here's how you do a pencil push-up. Grab a pencil or a pen and a ruler if you have one. Hold the pencil or pen out in front of your eyes and practice keeping it clear and single. So if you see only one pencil tip when holding it in front of your eyes, then slowly move the pencil closer to your nose. If at any point you see the pencil becomes double or becomes two pencils, or pens in my case, then slowly move the pencil or pen back until it becomes only one pencil. And then hold it for 10 seconds. Repeat the steps trying to get the pencil closer and closer to your nose without seeing two pencils. The ruler is used to track how close you can actually get the pencil to your nose while maintaining single vision. Some people like to get about to the point to where it's double, bring it out, hold it for 10 seconds, and then get a ruler and kind of measure that distance and kind of gauge. And they set goals on getting closer and closer to the nose when they do it. Some people have a difficult time converging their eyes for long periods of time. This is where it's helpful to try and see how close you can bring the pencil to your nose before it finally becomes double. But sometimes people have difficulty diverging their eyes, and in this case it would also be useful to push the pen or the pencil further from the nose, repeating the same steps as before, just pushing it away from the nose. Practice this exercise for 15 minutes per day, especially if you ever get double vision when your eyes are tired. The fourth exercise has a name that sounds complicated, but the exercise itself is very easy to learn and do. This particular exercise not only helps us gain more of an awareness of our eyes as they work together, but also helps us control eye movements as we shift focus from one distance to the next. The name of this exercise is physiological diplopia, and here's how it goes. Hold two fingers up in front of our eyes. The first finger is about 10 inches from your nose, and the second is about 10 inches behind the next. Now look at the finger closest to your nose first. As you do so, you'll notice that you've induced double vision on the distance finger because now it looks like there are two fingers out here being held up while you're looking at this one. Now shift your focus to the finger furthest from your nose. As you do so, you'll notice that it looks like two fingers are being held up with the hand closest to your nose, even though there's just one. Practice taking about 3 seconds per finger, going back and forth and looking for that double vision effect. And do this for about 15 minutes at a time. Sometimes the eyes have a hard time working together in general, and as a result, our depth perception is not very good. If you happen to do this exercise and you don't see double vision, it might mean that your brain is ignoring the signal from one eye and that your depth perception could be compromised. When the brain ignores the signal from one eye, it's called suppression. And sometimes this happens when people have a lot of astigmatism in one eye, or for some reason there's one eye that's much more dominant than the other. So this exercise not only gives your eyes some practice focusing and fusing two images together, but it also gives you feedback, letting you know if your eyes are teaming well together or not, or if your brain is ignoring the signal from one eye. If your vision's blurry even after performing the exercises discussed earlier, then it's necessary to schedule an eye exam with your local optometrist to go through an in-office exercise called refraction. This is our 5th and final exercise to discuss. Through a refraction, your optometrist can determine the lens power needed to properly refocus your eyesight with the use of glasses or contacts. Through this exercise, your optometrist essentially takes light that hits the surface of the eye and doesn't quite focus before it hits the retina, and refocuses that focal point of light to where it's placed right on the retina. That helps you see 20/20, or at least helps you see as well as your eyes can possibly see. So schedule an appointment to have this done with your optometrist if it's been more than a year since your last eye exam, and get focused. Oftentimes in my practice, I find that people have pretty good eyesight and are not normally wearing eyeglasses because of that, but they can actually get their eyes correctable to even better than 20/20, like 2015 or 2010. So it makes their good eyesight more high definition, allowing people to see better at night on the road and maybe even be able to actually see their HD TV in actual HD. On all of these exercises, consistency is key in order to see good results. If you like the content in this video, hit the like button for me and make sure and watch my next video where I'll be teaming up with Dr. Neil Gaiman, who has his own YouTube channel called Dr. Eye Guy, and we'll be discussing a question that a lot of people have about whether or not wearing glasses will make your eyes weak. And I'll see you in the next video.